In Massachusetts nursing home, 1 in every 7 who are infected with COVID-19 have died. In the first months of the pandemic, elder care facilities faced particular difficulties that resulted in a greater death toll for seniors. According to the Boston Globe, the state had the second highest number of COVID-19 deaths in long-term care facilities in the country. In March, nursing homes across the state were unable to secure PPE because of limited supplies and because managers did not want to alarm their residents. Also, nursing homes could not conduct widespread testing, which led to more infections. Natasha Whedon, the Director of Public Health in Arlington, is here with more information.
Some of the challenges that the long-term care facilities and nursing facilities had faced at the beginning were just the lack of PPE. As a result, they had a lot of staffing shortages where staff had to be out because they were either sick or under quarantine. There was a lot of limitations to them having access to testing right away.
I asked her what has improved in this area since the beginning of the pandemic.
We have a regular contact at the state for each of the facilities here in town. I think there's been a lot of protective measures that have been put in place. The COVID guidelines for visitation and sanitation, personal protective equipment that needs to be worn. I think all of these measures have really helped to really control the spread in these facilities.
Director also said Arlington's long-term care facilities have kept the population safe.
The long-term care facilities here in Arlington are doing a really good job protecting our most vulnerable population. They have a lot of safety procedures in place. They've been working on COVID-19 plans. There's regular communication with the health department as well as state affiliates to really make sure that they're doing everything they can to protect their communities at large.
According to the town's COVID-19 figures, as of Wednesday, October 7, 144 out of 374 total confirmed cases are aged 70 and older. According to the state's weekly COVID-19 public health report, 90% or more of staff at the long-term health facilities and nursing homes should get a COVID-19 test, and the data from nursing homes in Arlington was also included. One bright note comes from the communication director at the Park Avenue Health Center. Jeffrey Thompson said that ever since May, there have been no new cases at that facility. Bridget Lynch, director of nursing at Park Avenue Health Center, told us how the facility kept the population safe recently.
Mass Department of Public Health has done a great job leading us with guidance that comes up regularly every Wednesday and every week to give us the best guidance in how to take care of these residents and keep us all safe. We're in constant contact with mass epidemiologists, which again help us for infection control purposes, what to do, what not to do.
Mark O'Flaherty, administrator at Park Avenue Health Center, also talked about the health center's working conditions during COVID-19.
As far as the working conditions, our employees are doing a great job at keeping both the residents safe, as Ms. Lynch said, and as well keeping themselves safe. So we certainly are happy that we have no one in the building that is positive. All of our residents are either recovered or negative. We work very diligently every day.
Administrator also said the facility has been preparing for the coming winter.
We're taking very strict approaches on our screening. We're asking for the cooperation of both our family members, our residents, and our staff, which we have received, and it's been very, very supportive in keeping our building COVID-free.
According to the administrator, the staff, residents, and families all have been supportive and care for those in need.
And so for that reason, I want to keep that sign out there to remind us each day of the dedication and sacrifice.
Nursing home residents are among the most vulnerable to COVID-19. Happily, Arlington senior facilities have had great success keeping their populations safe in the last number of months. For ACMi News, I'm Inyeong Kim.